I wanted to introduce myself. I'm the new mammographer. My name is Shay, and I kind of wanted to tell you a little bit about myself. I am a breast cancer survivor. So my story starts as this. I took a job in 2015 as the director of imaging at a location in Shawnee. Now, that might not seem like a big deal, but I live in Yukon, and that's 2 hours on the road every day. I didn't really know that I wanted to do that, so it was a struggle taking that job, but I did. And in January of 2016, I had been there for 3 months. And my mammographer came to me, well, she came to the department really, and she asked if anyone needed their mammogram. She had an inspection coming up and she needed good films. So I said, hey, I just turned 40, you can do mine. Now, 3 years prior to that, I had had a baseline and it was clean. I have no family history of breast cancer. I did not take birth control and I breastfed my kids. I was also pretty healthy, so I was just helping her out. I was not a candidate for breast cancer, but I was. And she found it. 5 days later, I found out I had breast cancer. It changed my world. It changed everything in my world. I went to my oncologist, and the thing she told me was, your cancer's tiny. It's very small. We can do a lumpectomy and it'll be fine. But it's very aggressive. So if you hadn't done that mammogram when you did, we might not have found it in time. I say that to let all the women know out there that you may not think you need a mammogram. You may not think that you're a candidate for breast cancer, but yearly it is so vital that you get your mammogram. For me, I had a double mastectomy. I didn't have to, but because my cancer was aggressive, I chose to be aggressive too. I also had chemo for 1 year. I lost my hair. So I lost my hair and I lost my breasts. But I was here. After being the patient myself, I realized that my place was to help other women. My place was to be there and comfort other women. When you get a mammogram, it's not something you enjoy doing, obviously. People have horror stories about them. They hurt, you squish me. And a lot of women don't come back because of that, because they don't like having them or they're afraid of having them. But my job, I feel, my purpose is to do an exam that not only gets excellent images, but comforts that woman, that patient, and lets her know that it's important to come back and it's okay to come back and it's not painful. That's my job. That's what I do here. That's what I care about the most. I care about my patients. I care about being there for the women that need me.